Hello, everybody. My name is Carlos. I'm one of your clinical instructors for this ICU rotation. I know everybody's upset about not having this time in the ICU. Let's try to make the best of this. We usually have a day where we get together and we talk about what to expect in the rotation and what to do and things like that. We didn't have that today. So I'm sending you this video. It's probably going to be about 7 to 10 minutes long. And I'm going to tell you a couple things that I want you to look up and I want you to be ready for this clinical rotation. The biggest thing is this. First, number one, I don't want to waste time on the conference day, so I want to tell you a little bit about myself. So my name is Carlos. I currently work as a flight nurse for a pretty busy system in New Jersey. I've been a flight nurse for over 2 years now. Before this job, I worked for Stab Medevac in Pittsburgh, also as a flight nurse. And before that, I have done cardiothoracic ICU, neuro ICU, medical ICU, and I worked in 3 level 1 trauma centers as a trauma nurse. Before that, I also I was a critical care flight paramedic in the Army, and I have a lot of experience when it comes to critical care and transport by either air, sea, or land, ground. So that's just a little bit about me. I don't want to overwhelm you with things. There's no point. But the big takeaway from that is this. I've seen, because of my time in the ICU, I've seen what one of the greatest deficits for new nurses. And one of the biggest deficits that I see in the ICU or in nursing in general is that sometimes we try to run before we crawl. And that's one of the things that I want to work on right now and for this clinical time and clinical group. So I'm huge on understanding how medications work. Why? Because 70% of what you will do as a nurse in your first year will be pass medications. And I feel that sometimes we pass medications that we don't really understand. And hopefully we can work together to get there. What you need to know is that in order to be good in pharmacology, you have to be good at physiology. Guys, always remember the basic comes before the advanced stuff. The basic stuff is always before the advanced stuff. So we're gonna work on trying to develop in these little 3 conferences your knowledge on basic stuff. We're gonna keep it basic. You need to understand this. All the drips that we will do in the ICU, all the vents, all the stuff that happens in the ICU is just a little more advanced of what we see on a regular different floor. So that's why I focus a lot on basic anatomy, basic physiology, and pharmacology. I'm huge on that. With that being said, I need you. Most of us up to this point in your career as a nurse, you've been memorizing side effects of medications before the instructor comes to you to do the medication pass. So for me, though, it's gonna be a little different. We need to understand the mechanism of action of medications. We need to know how they work. If we know how they work, we'll know the side effects. We'll know how they affect or react with other medications, synergistic effects or blocking effects, inhibiting effects. So I'm telling you, beta blockers is one of the things that I'm gonna ask you to look up. Beta blockers are one of the most common medications that we see in the US currently. Their work is the basics for every drip in the intensive care. If you know beta blockers, you'll know and understand ICU drips. Super simple. So that's the first thing I want you to look up. I want you to look up beta blockers mechanism of action, because we will talk about that. Also, with that being said, I know this sucks. I like to be hands-on. That's how I learn. But we have to do what we have to do, okay? And you have to know that nursing is such a unique profession because of the people that we have in it. We adapt and overcome. We're very good at it. So, guys, let's just adapt and overcome and make the best out of this. So, beta blockers. Another medication that is very common in the ICU in current days are albuterol, nebulizers. Pretty much, a lot of people get nebulizers in the hospital. So we're gonna look up a nebulizer, albuterol. look it up, mechanism of action, tell me what it does. Let me know what it does. Those two. Albuterol has to do, if you understand albuterol, I'm telling you, you will understand drips in the ICU, okay? Those two. Calcium channel blockers are a very common medication nowadays, but I think I'm gonna leave that for later. I might make you a video on calcium channel blockers so you can understand that. But we're gonna focus on beta blockers and beta agonist with albuterol. The last one I want you to look up is Lasix. Lasix, and there's another medication called lisinopril. This medication belongs to a group of medications called ACE inhibitors. So do me a favor. I want to give you names. So look up low pressure, look up albuterol, look up Lasix, look up lisinopril, and look up losartan. Losartan is an angiotensin II receptor blocker. Look it up. Mechanism of action. We need participation. So as a matter of fact, I'm gonna make this a little easier. All of you look up that medication, but I have with me, actually I'm not gonna assign anything to you, just look them up. You've been up to this point using these medications. Some of you, most of you should have already gave this medication. You should have given this medication already because they are so prevalent, you know, and if you did med search rotations, you probably pass a beta blocker, Lasix, lisinopril, or losartan. Another one that I want you to look up, and that's just my thing, I want you to look up Protonix, okay? Tell me why you give it, tell me why you have given it. And the last thing, on Tuesday, we're going to talk about sympathetic and parasympathetic system. Huge in the ICU, huge. So I expect you to be prepared with those things, okay? It's not much, it's 5 medications and pretty simple stuff. And the sympathetic and parasympathetic stuff. Super simple. And that's what I expect from you on Tuesday. So hopefully by this time, hopefully we can make up, agree on the time of the conference. We can get all together and we can have the conference. The conference, guys, I'm getting paid for this. And I'm trying to convey some of the knowledge that I have, and it's hard for me because I do not have you with a patient. So we're gonna it's not gonna be the most pleasant experience unless we make it out to be. So I'm gonna try to get some pictures. I'm gonna try to get something to try to make it a little interactive. I got a whiteboard. We're gonna go to town on Tuesday. Just bring your best attitude. Because attitude is everything, okay? With that being said, I told you about me, I told you what I expect. Please, your paperwork, it's due at the end of that day. Look up those things. We're gonna go through those cases. We're gonna go together, but I'm not gonna do that for you. That is your job. Now, if you have questions, by all means ask me. If you ask me the questions on a different, you can even call me if you want to. I'll give you my phone number. So you can, if you're working on your paperwork and you have questions, you can call me. I'm super reachable and I'm already scheduled a day to do this. So you guys are my priority, and hopefully we can make the best out of this situation. Also, actually, I was gonna have you introduce yourself a little bit to the. Actually, we'll do that. Anyway, I'm coming to minute 10. That's what I wanted to tell you. I want to tell you what I expect and what we're going to review. Paperwork is all easy. We will walk through this together. It is my first time doing this. It is your first time doing this. We're a team, and we're gonna help each other. Okay? It's easy. It's good. It's just about attitude. So we got this, team. Perfect. With that being said, you have a good day, have a good night, and I hope to see you on Tuesday. Have a good night.